Hello and welcome to another MRCOG video. This video is on randomized control trials or RCTs. This is relevant for part 1, part 2 and possibly even part 3 exams. An RCT is the best design for assessing the effectiveness of a treatment. Often a treatment may be compared to another treatment or it may be compared to a placebo. The design of an RCT is fairly straightforward. You have a relevant group of patients and then you randomize them to one treatment or the other, or placebo as I mentioned earlier. Then you follow up the patients to see whether they develop the outcome of interest. But to do a clinical trial, a randomized trial well, you need to pay attention to the details. Details in terms of the quality of the trial, the methods that are employed. Now there are 6 features that you need to pay particular attention to. The first of these 6 features is whether the investigators employed randomization, proper randomization. If they used a random number table or a computer-generated randomization algorithm, then that would be considered a proper randomization. Now, some investigators would alternate the patients. The first patient who comes through gets the first treatment, the second patient who comes through gets the second treatment. That is not proper randomization. Others would look at the birth date of the patient, and if it's an odd number, then the patient gets one treatment, and if the birth date is an even number, then they get the other treatment. That again isn't proper randomization. The second feature is called allocation concealment. This is where the investigator who is performing the randomization, so allocating the patients to either this treatment or the other treatment or placebo, would not know what treatment that the patient would be getting. So the person who is doing the randomization wouldn't have the opportunity to bias the results. The third feature, many of you will know, is blinding. Blinding is masking the patients and ideally the healthcare providers while the trial is taking place, so that the patients and the care providers do not know what they are getting in terms of treatment. The fourth quality feature is called ITT, or intention to treat. This is where a patient who has been allocated to a particular treatment is analyzed as though they received that treatment, even if they ended up getting, say, the other treatment in that trial or never received any treatment. So this is the principle of ITT, or intention to treat. You intended them to have a particular treatment following the randomization, so you analyze the patient as though they had that particular treatment. And that principle is very important to preserve the validity of the trial. The fifth quality feature is ensuring that the follow-up rate all the way to the primary outcome is good. Ideally, more than 95% of patients who were randomized should have been followed up to the primary outcome. If not, at least more than 90% would be good. The sixth and the final feature for quality is a pretty intuitive one, whereby the patients who are getting the experimental treatment and the control treatment should be treated the same in the trial, other than, of course, for the experimental intervention. So those are the 6 features to ensure that a study is of good quality, a randomized trial is of good quality. You should also ensure that the study had sufficient power to pick up a difference in treatment effects if one existed. So the investigators should make sure that they had an adequate sample size to ensure sufficient power. And finally, you should ensure that the study was ethically sound, so the investigators should have obtained ethics approval and patient consent to conduct the study. So these are the quality features of a randomized controlled trial, and in another video we will discuss how to make sense of the numbers that you get from randomized trials. That is, numbers such as risks, relative risks, absolute risk difference, numbers needed to treat, and confidence interval. Until we meet on another video or at the weekend course in Birmingham, goodbye.